The retromandibular vein drains the temporal region via the posterior auricular and superficial temporal vessels. Also, this vein drains the deep region of the face, namely the structures of infratemporal fossa, pterigopalatine fossa, nasal cavity, and particularly the orbit and oral cavity, by the pterigoid venous plexus, which is here. The pterigoid venous plexus forms the maxillary vein. By means of the transverse vein of the face, the maxillary vein is connected to the facial vein. The facial vein receives a lot of tiny tributaries from the soft tissues of the face: the angular vein, infraorbital vein, superior labial, inferior labial, and submental. It also receives some inflows from the pterigoid plexus. The main trunk of the retromandibular vein divides into two branches: an anterior division, which together with the anterior facial vein forms the facial trunk and empties into the internal jugular vein, and a posterior division, which is joined by the occipital vein and becomes the external jugular vein. The internal jugular vein collects the blood from the brain and is a direct continuation of the sigmoid dural sinus. Also, it drains the superficial parts of the face via the facial trunk. In the neck, it receives tributaries from the thyroid gland, the superior thyroid veins. The large inferior thyroid vein, the main cause of bleeding in thyroidectomy, opens directly to the left brachiocephalic trunk, as well as the internal jugular vein itself. The external jugular vein perforates the deep fascia in the subclavian triangle and empties into subclavian vein. The vertebral vein comes here too. Here it is. The confluence of jugular veins with the subclavian vein and brachiocephalic trunk is known as the venous angle.